Dr. ZERROUK is here. He's going to talk about the French cultural translation and adaptation of the Australian disease-specific quality of life questionnaire for peripheral arterial disease. So it is interesting. First time I'm hearing this
Good morning,
questionnaire.
ladies and gentlemen. Thank you to give me the opportunity to talk about the French cross-cultural translation and adaptation of Osvalcol, an Australian disease-specific quality of life questionnaire for peripheral arterial disease. The study was conducted at the Department of Cardiovascular Surgery of Georges Pompidou Hospital of Paris, which is a part of René Descartes Medical School of Paris 5. The study was also approved and coordinated by the Department of Epidemiology of Professor Guillemin, Quality of Life platform of the CHU de Nancy at the Institute in CERN. Peripheral arterial disease is a common pathology with a prevalence 12 to 14 in the adult population. The handicap caused by intermittent claudication, which is significantly linked to this pathology, degrades patient quality of life. As we know, brachial index is the golden standard for PAD screening since it detects for both symptomatic and asymptomatic conditions. The use of claudication questionnaire, however, may help screening PAD both for epidemiologic research purposes and clinical practice. The majority of quality of life indices are generic and are designed to assess all the area associated mobility. The generic indices lack sensitivity and may not adequately assess quality of life in patients with a specific chronic disease process where many of the questions may be irrelevant, repetitive, and unnecessary. The Australian Vascular Quality of Life Index, Osvalcol, is a specific self-questionnaire developed to evaluate the quality of life subject affected by PAD. The Osvalcol is an approved tool for the quality of life assessment for patients with peripheral vascular disease in the clinic setting, comparing to the SF-36, the golden standard. PAD rarely occurs in isolation. Often the patients are vasculopath with concomitant cardio and cerebrovascular disease. Neither clause S or the vascular call is taking this into the consideration. And the Osvalcol has been developed to bridge this gap and to provide a global assessment for the vasculopath. It has been designed to provide valuable information to the clinician and in the clinical research setting. As you can see, the Osvalcol consists of 10 questions and divided into 3 domains. First domain, the general health, perception. Second, the function, mobility, and pains. And the third, psychosocial aspects. As you can see, the questions are very easy to answer. For instance, you can say, how often do you see your friends and relatives or participate in hobbies? Have you felt lonely, unhappy, depressed, or anxious over the past month? Each question is scored using weight values, which give a range of possible totals from 0 to 100, where 100 there is no impairment of quality of life, and 0 is totally impairment of quality of life. The study, the adaptation of a health statute questionnaire for new countries, cultures, or languages require a new method to achieve equivalence between the original source and the target versions. The Osvalcol was submitted to translation and cross-cultural adaptation according to internationally accepted and recommended guidelines of Bombardier and Guillemin. The objective is to obtain a cross-cultural translation and adaptation of the Osvalcol in French. As you can see, The method follows 5 steps. First step, the forward translation with the independent translation. The second is synthesis with the harmonized of the 3 translations. Third, a backward translation with to obtain the 2 back translation, and after a pre-test and a debriefing cognitive until obtain the final version. For the first, the forward translations, the source version of the IUA questionnaire was translated separately by 3 independent translators, T1, T2, and T3. The different profile of the 3 translators assured a good agreement and accuracy with original version in terms of both of content and the terminology. T1 was a vascular physician, familiar with the concept being examined. He is called the no-naive translator. T2 and T3 was a translator and were neither aware nor informed of the concept being quantified and had no medical background. They called the naive translator. In the step 2, the synthesis, the 3 resulting translations were reviewed by an expert committee that included the 3 translators, the principal investigator. They were compared with another and with English version. They discussed any discrepancy until a consensus was reached, and the result of the 3 translations were then synthesized into a common French translation. The third step, the backward translation, were done by 2 native English speakers, North American, with French as their second language, and carry out 2 back translations of the French answer into English. They were entirely independent and were performed without knowledge of the source of the questionnaire. Neither of the back translation was familiar with the concept explored, and both were blind to English original. The 2 translators at step 3 did not participate to the first stage. The fourth step was the expert committee formed by consisting of 1 of the translators, 1 of the back translators, and 2 clinicians, the vascular surgeon and psychologist, the supervisor, and the methodologist. I want to say that all the stages of the translation process were documented in written form. The task of the committee was to guarantee semantic and conceptual equivalence between the French and English version. The consensus was found for all parts of the questionnaire. The translation, back translation, and notes made in comparing the translation and comparing the translation were used to develop a pre-final version of the French Ausweikel. Finally, the pre-final version was tested in a sample of 21 patients with vascular claudication. After completion, a research assistant checked the response and asked them if there is any ambiguities, wording, or easy to understand. The findings from this phase, which is called the phase validity, were considered by the work group to have the final French version. So the result, as you can see, on the French version, all the question was conserved. Same question. Only the 7th question was difficult to translate with 1 word, because the funny terms was difficult to translate. The time it took to fill the questionnaire was an average of 3 minutes, and the field test interview participants have answered all the questions and find them comprehensive and relevant. In the conclusion, the Ausweikel is rapid and easy to complete in both of the original version and the French version. In addition,